June 26 marks International Day Against Drug Abuse and Illicit Trafficking, also known as World Drug Day. The day aims at combating misinformation and promotes sharing the facts on drugs, from health risks to solutions, tackling the world drug problem to evidence-based prevention, treatment and care. And to talk more on this, we're joined by World Changes Canada's chairperson, Lucas Matlagane. Lucas, good evening, and thank you so much for your time tonight. Talk to us then about the work that the World Changes candidates do to, with communities then that are riddled with drugs.
Good evening, Bonnie, and thanks for the opportunity. Today, like as you mentioned, the 26th of June is International Day Against Drug Abuse and Illicit Trafficking. So the day that World Changes candidate has been commemorating over the past 17 years. 19 years ago, we assisted Kabelo Mabalani to quit the drugs, and the confrontation was very simple. When we spoke to him, it was like, Kabelo, at that time, if you to quit the drugs, you've got like a great future ahead. And that is also recorded in his book, I Ran for My Life. So upon him deciding to quit the drugs, we took him through the process until he get clean. But today, as we are commemorating the day, we're also celebrating the 19 years of Kabelo being clean from drugs. And now we are also happy to say we have realized the future that we are talking to Kabelo about. When we said you've got a bright future ahead, he quit the drugs, and today we're talking to Kabelo as a husband, a father of two, a businessman, a comrade marathon runner, a pastor. So it actually encourages us to say, if we were to save one soul today, in 19 years from today, that person would have probably achieved more than what Kabelo has achieved. So we have been commemorating the day throughout the province, sometimes in other provinces as well. But we are making sure that on the day we raise awareness about the danger of substance abuse in our community, because our mission is to have a drug-free community, and our vision is to change the world one soul at a time.
And when you then look at, that time when you had to have the conversations with Kabelo about quitting, was it easy for him to really understand that he needs to take this drastic approach? And also talk to us then about some of the individuals that you've subsequently met as part of this program to try and help them to be clean. Is it always easy for them to say yes to looking at rehab and kicking the habit?
Having gone through this journey, I can give you two answers. It's easy and sometimes it's not, because it's always depending on the individual and the timing. Sometimes we get approached by people who are saying, I'm ready, please assist me. And with our experience, we are able to assess and know this person is really going to quit. We have a good history of few people that we helped. Actually, some of them came to our events today. There's been a lot of positive stories. That's actually what makes us go and sleep well, because you helped a person. There is a guy that we helped, and it has been the family that has actually been coming and thanking us to say, we can't believe our son's life has turned around the way it did, because this person sold everything in the house, and he used to be a nightmare into the family. When the person is ready and they are willing to quit, it's much easier. But sometimes, yes, you can confront a person and they will listen. I remember when we were confronting Kabelo, the signs were not good, because he was working with the late Moses Mulelekwa, and then there was also the death of TK Muhinga. And it was like, you look at the situation around you, you can tell where you can end up. And it wasn't that easy, because I think it took him probably about 3 days insisting that we are like, now I am ready, I need help. And that's not the end. After you have helped a person, when they come back from the rehab, that's where the main job starts, which is called aftercare. World Changes candidate has got a very strong a positive program in terms of the aftercare, because that's where the main issue is. When the person comes back, what do you do with that person? How do you integrate the person into the community, into the family that lost trust into this person, that lost trust into that? I mean, most of the time, you find that we are working alone with that person. without even the support of the family, because the family don't believe that person can actually turn their life around. But I can tell you now, the signs are very positive. When a person wants to change their life, the signs are very positive. And I do have faith. Otherwise, I would have stopped actually campaigning on this thing if I didn't believe that people can really change, because I've seen a lot of people actually changing and turning their lives around. We've got a lot of stories that I can tell you. It will take us the whole night, but I could, more than that, I can even bring in those people. And then some of them, you also got to understand the sensitive part of helping someone who's into drugs, because you taking him from those dealers that are seeing him as a customer. I mean, today we had boys that were saying, I have to spend almost about 400 Rand a day, which I don't have. So every day I wake up and have to think about how I'm going to get that 400 Rand. That means I'm going to go and rob someone else. To that person, the person that is selling the drugs to that person, then you're taking away a customer. So you don't want to expose those people every time you save them, because I mean they've got a lot of challenges. For us, it's no longer it's not so much about bragging about the person that we have helped. Kabelo is but one of those people that was completely different. And let me tell you something, Boniwe. The situation was different then. That time, the drugs was something that you only hear about it being sold in Sandton and Hillbrook. But today, the drugs are in the townships, and that makes it even more difficult, because this person lives in the same area. And there is an organization that invited us to come to Kwatema today called Hlasimpo Community Development. And they invited us to say, you know, but Kwatema, Tsakani, and Duduza are a hotspot. And we drove around, and it's a mess. Bongiwe, I wish one day you guys could just like send your team in there and check where the country is going. And I can tell you, the problem with our country is two things. We lack patriotism, we lack compassion. We don't love ourselves, we don't love our country. And that's the main problem, because you know, we allow people to destroy our country in front of our eyes, because the stories that you get from these people, they tell you who sell the drugs to and how they get them and all that. It's heartbreaking. It's heartbreaking.
And I know that you've alluded to it, but just tell us the impact then that drugs have on communities and families, especially when you look at a day like this, given the fact that some of the families themselves are even battling to get their loved ones into rehab.
It's terrible, and the situation is not so much about getting a person into the rehab, because families are desperate to get people into rehab, and the issue here is not about getting a person into the rehab. It's about getting a person who's ready to clean their life into that, because the drugs are wreaking havoc into families. We get approached by families every day that says, can you get my son or my daughter into the rehab? The following day, they want something so quick to fix that, but it's not a quick fix. It's something that you must go through a process, and that process starts with us talking to the person that's affected. Forget about this family. We talk about the person, and then when the family approaches us and to say, we need you to help our daughter or our son, the first thing is that person ready? Well, obviously they will always tell you that they are ready, but then when we meet with that person, we can assess, we can already tell that the person is ready. Our organization, World Changers Candidate, is actually running 4 programs. One is awareness, which is what we did today. We create awareness about the danger of substance abuse in the community, and we do that every year on the 26th of June. The second one is prevention. We try to go around even to the schools and tell people not to start, because the best way to beat the drugs is to not start at all. So when we get a person that now willing to clean, we have got a lot of organizations that we're working with, including Sokoma Sake Development, which has got the whole variety of with the social workers that will take a person through the process and until the person goes into the rehab. As the person goes into the rehab, we would have spoken to that person about what is it that we're going to do with that person as an aftercare program when the person comes back. And then throughout that, and when they come back from the rehab, that's where our main job starts. And most of the ones that we have helped, they now being converted as the World Changers Candidate. Hence, we are saying we're changing the world one soul at a time. It's no longer about just numbers, but we just know when we achieve that goal. And like just to mention today, as soon as we finished with the program in the stadium, we had 2 boys that were standing outside in the gate and asking for help. So those boys, we have their details, because you can only get a person's address, because people that are into drugs, into Nyaope, they don't have cell phones. You give them their address, and if they're honest, when you go to the address, you find that person, then you've got like at least one step into helping that person. And then once you start engaging with that person, there is a lot of process, and people normally want us to do it overnight. It doesn't work like that. So you have a person that has to go through counseling, and then has to go through a pre-admission process as well. So go through that pre-admission process. But people who are willing to change and turn their life around, they wait. Even if it's like for a month, just working on this person, they wait. But the ones that will say, no, listen, I'm ready, take me tomorrow, it's like it's a no-go zone area. But like I said in the beginning with my answer, it only takes the person that is willing to clean up. When that person is willing to clean up, the rest is history.
All right. Thank you so much for your time tonight. Certainly, some amazing work that you are doing with these communities, and certainly an important initiative there. And that was World Changes Candidates Chairperson Lucas Matlagane on the